professionals and physiotherapists. It comprises 12 departments and 1 institute, amongst which are departments of pediatrics, obstetrics and gynecology, surgery, medicine, community medicine, nursing, physiotherapy, radiology, and the Institute of Child Health.
Well, essentially, all the departments still can be grouped into 3 different groups. The Department of Nursing produces high-level manpower for nursing education. They provide the teachers in the various schools of nursing. And then the physiotherapy department also is responsible for the production of about 80% of all the physiotherapists in the country. And then the other 11 departments, that includes the institute, are all responsible for the training of medical doctors.
It is perhaps noteworthy to mention that even though the Faculty of Public Health also lays claim to the Institute of Child Health, administratively, the institute is under the Faculty of Clinical Sciences.
The base faculty is the Faculty of Clinical Sciences. And then, that recently we have the Faculty of Public Health coming on. And because we do community work, we relate with people, obviously we need to belong to the Faculty of Public Health as well. So we have our feet astride the 2 faculties. The relationship is excellent. The base faculty is that of Clinical Sciences, and the other faculty is that of Public Health, to allow us to be able to carry out the mandate given to the institute. It was set up as an Institute of Child Health from a grant from UAC, United African Company, for independence. That was in 1961, even though independence was in 1960. The grant was given to the federal government in 1961 to establish an Institute of Child Health that will see to research into children's problem, not just only children. And it was supposed to be the first of a number of series of Institute of Child Health to be built around the country. So this is actually the first Institute of Child Health in the country. Over the years, the Institute has tried to fulfill the mandate to look at problems of children, not just when they come to hospital, but the problems as they occur in the community, that is, before they get so ill to come to hospital. So obviously that will already show the distinction between the Department of Pediatrics, where the sick ones are being taken care of, and the Institute of Child Health, which is a research institute to carry out research into the problems of children. What makes them ill, what contributes to the illness, what worsens it, what improves the situation, and how can these things be stopped. Now, I said children. Really, it's not just only for the problems of children. And in the last few years, while we're continuing with research into the problems of children, we've started looking into the problems of adults as well, And to this end, a number of studies are being carried out currently as we're talking, in collaboration with some institutions worldwide and from all parts of the world, Europe, USA, and even some African countries.
In collaboration with other departments in the College of Medicine, the Institute of Child Health has, over the years, carried out various studies related to the health of the African child.
But of particular interest is the fact that you will notice, if you see today, that yellow fever has been introduced into the immunization schedule of children in Nigeria. A landmark study was carried out in this place, and where we looked at the most appropriate time when children could be immunized with yellow fever, when it would give them the maximum protection and give them minimum discomfort like fever and other complications. That was carried out in this place, and we found that it can actually be given at the same time with that of measles, that is yellow fever. that was carried out here. And again, in collaboration with the Department of Virology, we have identified quite a number of strains of measles virus that are not the ones used in making the vaccines that we use. That partly explains why, even though some children might be immunized with measles, they still get some measles later. They could still get some measles, because the strain of measles virus that are around here, not just only around Ibadan, around the West African region, could be quite distinct, different from the one used in preparing the vaccine. So quite a lot of studies have been carried out here.
On its part, and over the past several years, the mother faculty, Faculty of Clinical Sciences, has been involved in several significant research activities.
We have Oshintokun and others in the Department of Medicine who established the relationship between the consumption of Gary and a specific disease entity called tropical ataxic neuropathy. This has to do with the way Gary is being prepared in some parts of Nigeria, especially in the southwest, and how it is related to what we call rase. They were able to establish the relationship, and this has significantly improved the modalities of making Gary, and therefore would have reduced the incidence of tropical ataxic neuropathy. We also have Falashe, the current Vice Chancellor, who worked in the same Department of Medicine and established the relationship between eosinophilia and heart muscle disease. We have had people in the old preventive and social medicine department, like Professor Lucas, and Professor Lucas looked at the fact that obstructive neuropathy related to schistosomiasis is reversible by treatment. And likewise, Professor Kale, who has worked extensively in the eradication of guinea worm in Nigeria. Coming to the Department of Pediatrics, we have had Professor Adeni and others who have worked extensively on establishing the relationship between quartan malaria and nephropathy, that is nephrotic syndrome, and the fact that this is a distinct disease entity. And for the first time, we have in the Department of Pediatrics, Shudende is working on the production of pure cell lines for Plasmodium falciparum malaria.
Another baby of the College of Medicine is the Faculty of Public Health, which was inaugurated on 31st January 2002 as an offshoot of the Faculty of Clinical Sciences and Faculty of Basic Medical Sciences. The purpose of its creation was to emphasize the need to